All right. First off, I want to thank everybody for joining us here tonight for session 1 of our Living Well series. This is a really exciting collaboration between the Farmhouse Classroom of Farmhouse Kitchen and Downtown Wellness Berks, which some of you may or may not be familiar with already. So we are a group of local wellness professionals that kind of work with each other and help each other, as well as help the community figure out and become aware of different formats and different approaches to leading a healthy lifestyle. So a couple things I wanted to go over. I just wanted to make sure if you're not talking, if you could please stay muted. So if everybody could do that for me. Actually, I think I actually can do that. I can mute everybody. Let me see if that works. Yes, I think that worked. So now if you need to talk, then you can unmute yourself. But I'll go over a few little ground guidelines. So for a lot of you are already familiar with Zoom. But as far as some of the kind of courtesies and etiquette go, number one, usually stay muted if you're not speaking or aren't part of like the current conversation. Second, just because, there's lots of background noise sometimes and we want to minimize that so we can get the best out of our communications. Also, throughout the course of the evening, I just want to make sure that that everyone is sorry, I'm making sure other people are coming in here. I want to make sure that everyone, if they want a chance to ask a question, please utilize the chat, which is, if you look at your screen, it'll be in the kind of bottom middle, and you can click that open and type me a message to say that you have a question, or if you have a comment that I can field for you. So please just utilize that. Yep, thanks, buddy. And that'll help us kind of move smoothly. And if anyone wants a chance to speak, then that'll prompt me to give you the chance, and I can either field a question for you, or if you really want to say it, just ask, and I will kind of prompt you to ask your question. So also I wanted to go over just that this presentation for Farmhouse Classroom and through Downtown Wellness Berks for the Living Well series is being provided for educational, informational purposes. So all the things we talk about, the statements of fact and opinions that we express here are those of our individual participants. So these discussions aren't to be used as a substitute for professional medical advice, diagnosis, or treatment. And as a group, Downtown Wellness Berks aims to raise awareness about the many supportive habits, helpers, and local practitioners and businesses that can aid in the building of a healthier lifestyle. So attendees should also note, as I said before, that these are going to be recorded, and the content is maybe shared on various media platforms. So just so everyone's aware of that. And so that's my little spiel that I wanted to make sure we went over with for everyone. And somebody else is in the waiting room here. Okay. And now I would like to introduce some of our Downtown Wellness Berks affiliates that are joining us here tonight. So our Downtown Wellness Berks folks will kind of act as the discussion leaders. But again, I want to make sure everybody knows that now, if you're comfortable with just listening and taking it all in, that's fine. But please feel free to ask questions. If you have any stories of your own to share that are relevant to the conversation that's being had, please let me know and we'll let you in there. So I'm just going to go in the order I see you guys on the screen. So Buddy, could you please just give a little bit, talk a little bit about yourself, your practice, and kind of how you help people lead a healthier lifestyle?
Sure. I'm kind of like your affiliate from up in the hills here. I'm in southern Schuylkill County, not Berks County. But up here we have Healthy Habits Natural Market. We have a health food store. I'm a chiropractor and also a functional medicine practitioner. And we're starting a new endeavor this year, groupreset.com, which is a 6-week lifestyle and metabolic reset program. So Been working with people for about 15 years now, with both traditional chiropractic stuff and the health and diet stuff. And our primary focus nowadays is helping people change their habits, get all that stuff that we're supposed to be getting, like sleep, water, good food, out in nature, sunlight, and kind of gravitating away from the supplements and some of the more expensive testing and complicated testing I've done in the past, because at the end of the day, if you're not doing the basics, none of that other stuff matters, and you just end up chasing a bunch of symptoms and end results of poor diet and lifestyle. So I've been really like laser focused on that part of it, the diet and lifestyle part.
Great. Thank you so much for joining us and taking the time. Next up, I have Sydney. Sydney, could you tell us a little bit about yourself and your practice, please?
Sure, awesome. Thank you so much, Courtney, for organizing this. I'm Sydney Malatrat. I am actually right in the heart of West Reading. I own Summit Massage LLC. So I am a licensed massage therapist and a licensed esthetician. I'm right on the main drag there in West Reading, right on Penn Avenue. I've been there for about a year and a half, and I specialize in rehabilitative and medical-based massage therapy and all-natural skincare as well. My practice very much wants to view massage therapy and skincare as something that people can do on a regular basis instead of the common mindset that people have as it being just a luxury. So I really want to help people have education in that and learn that, hey, this is something I can do all the time for the fantastic health benefits that this offers to me, especially after any type of trauma or injury or when you have conditions going on. But I'm super happy to be here. This is such an awesome group of people, so I can't wait.
Great. Thank you so much, Sydney. Sherry, are you okay to give a little bit about yourself? There you go. You got it.
Hi, everybody. Thank you so much. Yeah, I've recently had a significant medical issue myself, and I'm just getting back into things a little bit. But my name is Sherry Matthews. I'm a RN. I've been an RN for over 35 years. And in the last 4 years, I became certified nurse coach, and I went more in the holistic direction, and that's how I became affiliated with the Downtown Wellness Berks group through Courtney. And I have my own health coaching practice, and I enjoy working with clients in whatever area they are looking for help with, in either general wellness or chronic disease management, and even things like anxiety, and especially now with everything that's going on with COVID. And I also recently have become more educated in an area of energy medicine, and have been doing some group work with energy type tools to help with natural healing methods and self-healing and just self-care, and especially interested in helping caregivers like nurses or other health professionals, and even just people who have family members that they have to care for because they often don't care for themselves. So that's where my interests lie, but I'm always interested in learning new things, and I love being a part of this group. So thank you so much for inviting me to join.
Thank you, Sherry, for being here. I appreciate it. And Tiffany, can you talk a little bit about what you do for us, please? Oh, make sure you unmute. You're okay.
I told myself I was going to remember to do that too.
You're fine. That's one of the reasons I'm here, so don't worry.
Yeah, so hello everyone, and thank you for including me, Courtney.
No problem.
So I'm an herbalist. I'm the owner of Embark Herbals. I'm located in Moton. So I also have a degree in cellular molecular biology, and health science, a minor in health science, and I have studied under some of the renowned herbalists like David Winston and Don Olson. They were all co-founders of the American Herbalist Guild. So I've been interested in herbs since I was 14 years old. And I had, before I started this company, I had a greenhouse cleaning company for 20 years that I started when I was like 19, 20 years old. So again, kind of ties in with just education, educating people about health and wellness and like the toxins. Back then it was the toxins that were in cleaning products, but people knew that I studied herbs back then too, and eventually realized I needed to go, complete more education in that area, so that I could start an herbalist clinic. And I also have been trained in like functional blood analysis, and I offer DNA testing as well. So for me, it's kind of like an eclectic combination between the traditional use of herbs as well as more of the scientific based use and what we're finding out. And so I do one-on-one herbal consultations. I also do classes and workshops. And then I have a retail apothecary where I have probably about 400 or 500 different herbal tinctures. I can make custom formula blends for people, and 300, probably getting closer to 400 now, loose bulk herbs and teas that I sell in the shop. I'm from Chester County until we moved here 3 years ago. So one of the things that I noticed when I moved to this area was that there wasn't really a resource for things like that locally. So, it's something I've always wanted to do and been passionate about. But when I got to this area and saw there was a real need for that locally, decided this was the time. I took that as a sign that it was time to open up my own apothecary shop as well. So when I also get into some of like the nutritional recommendations for people, as well as referring them to other practitioners that I don't have expertise in, and it all converges. We should all be working together for some of these things that we have expertise in. So I don't know if there's anything else. I think that about sums it up.
Yeah, no, thank you so much. No, that's why I love this group so much, because everyone has such interesting and diverse backgrounds when it comes to health and wellness. And, it's really exciting to be part of this group. Whitney, can you give us a little background?
Sure. Hi, everybody. I'm Whitney George. I'm the functional nutritionist. I have a master's degree in human nutrition. I completed my functional nutrition residency with Dr. Kara Fitzgerald. She's a teacher through the Institute for Functional Medicine. And I am a practitioner and co-owner of Ampersand Integrative Wellness. We're in Wyomissing, right on State Hill Road. It's a collective, wellness collective group of us, myself, 2 personal trainers, 2 massage therapists, and a mental health therapist, physical therapy, and we just brought on music therapy. We also have yoga instructors, and so really taking care of mind, body, spirit in a whole way under one roof. And our name is Ampersand because we're everything and kind of like Downtown Wellness Berks. So we're a little microcosm of the larger whole here. And I got interested in health and wellness about 15 years ago and made a lot of strides in my own health by changing my diet. My brother was diagnosed with Crohn's disease about a year after that and decided to take on dietary changes and some supplements and never took a medication for it. So it's been a journey of health and wellness in my own family, and has brought me to really want to learn more and excel more and help others realize the power of healing in their own bodies.
That's awesome. Thank you. Yeah, that's what we're here to talk about. So great. Thank you so much, Whitney, for being here. We also have another affiliate joining us. I don't know how much she'll talk, but do you want to say hi, Marty? Thank you for coming. The owner of Farmhouse Kitchen is with us tonight as well. So she was definitely a mastermind to help bring this group together. And it looks like she's being attacked by one of her dogs right now. So I don't know if she can talk. Do you want to say hi, Marty?
Hi, hi, everybody. Yes, it always seems like the dogs constantly have to join when I do this. At any rate, I own the Farmhouse Kitchen, and Courtney has been an education coordinator since before day one, and she continues to do extraordinary work for us and for you all. And I'm thrilled to be part of this group and listening to everybody talk about what they're doing. And it seems like we keep growing and it keeps getting better and more interesting and full of love for everybody. So good evening.
Thank you so much for being here. We're happy to
Yeah.
have you. Oh, I have Jen
No.
waiting in the room. Okay. So, Marty, I'm going to mute you again. All right. So, we'll get started here. One of tonight's kind of overarching theme is, I called it risk factor roll call. So I thought in order to talk about how we can attain health and wellness, we kind of have to talk a little bit about what happens when you're not, or what does it look like when you're not, or what are some of the pathways that people happen to find themselves down that might lead them to be more at risk for getting sick in every sense of the word. So we wanted to talk a little bit about some of the most common chronic illnesses and how they're interconnected to each other, as well as their effects on immunity and overall health. So one of the things I wanted to kind of talk about first is, and maybe Buddy and Whitney, you probably, I wanted to kind of explain to people a little bit about the difference between what kind of the philosophy between functional medicine and maybe the more kind of traditional kind of medical ideals that most people are used to hearing about. So could either one or both of you talk about that a little bit?
So sure. So we have it's kind of a continuum. So on one end of the continuum, you have we'll call it conventional medicine, and now they try to look for the cause of of your particular problem. So you come in with a symptom, they want to diagnose that. So they can diagnose it with a physical problem or a structural problem, like a tumor or a cyst or something like that, or they'll diagnose it with some sort of problem with one of the metabolic pathways. So you might have some blood issues that are off, or you might have an infection or something of that nature. But it's usually pretty far downstream from where the problem could arise. So for instance, let's say if it's a chronic sinus infection or chronic allergies, that's a good one to use. So chronic allergies. So what's the issue there? It's too much histamine perhaps, or there's something in the environment that's stimulating your allergies to become worse. So the treatment for that would be an antihistamine or some sort of allergy medicine like Allegra or something of that nature. Whereas in functional medicine, we might step back and say, well, why is this person having an abnormal response to these allergens in the environment? And why is that particular person different than anyone else out there? Someone in their household could be exposed to the same pet dander, but they're not having a strong reaction. Now, at the end of the day, some of that might be genetic, but I think far more common is that we just have a variety of factors that are making us more prone to having an elevated response. So you could have gut issues. So let's say you have yeast overgrowth or something like that. That's already putting you on the edge of becoming inflamed, or it's already stimulating a bit of a histamine release, which results in the itchy, scratchy eyes, skin issues, full sinuses, stuff like that. So now add in any stimulation at all that can make that worse. And now that puts you over the edge between someone that's maybe has a minor issue every once in a while, or someone that's constantly suffering from those allergic type symptoms or allergy type symptoms. So in functional medicine, we try to look at, okay, is the person like stress can cause an elevated response in some of those pathways. So you need to deal with the stress. And I know that sounds kind of esoteric and a little bit out there, but I've had people where we address every other thing we can. We address their chemical imbalances, nutrition, we remove toxic stuff from their environment, like personal care products and stuff like that. But they're still super stressed because they're at a job that sucks and they have a manager that's just on them all the time. they lose the job. Or this is a real life example. Quarantine hits, COVID hits. Now they're working from home. Now they're not with that pain in the butt manager that's sitting across from their desk every day, badgering them all day long. And all of a sudden, their health problems start to improve again. So that's where I see functional medicine. It's always taking it one step back and saying, well, why do you have that problem? I have a thyroid issue. Well, why? Because your thyroid hormone's low. Well, why? Because your thyroid's downregulated or not functioning as well. Why? Because you are eating gluten, and gluten is causing an autoimmune attack of your thyroid. So it's always asking why. Sometimes we never get to that original or that initial why, and you do your best that you can with the symptoms and stuff you're dealing with. But I think you got to ask the question. And to me, that's what functional medicine is.
That's awesome. Yeah. And I know, Whitney, you've talked about that the same way, where it's like this investigation. You have to keep digging deeper and deeper sometimes. So yeah, if you can give some of your input on the same question.
Yeah, it really is looking at root cause, but in the way, that Buddy described, where you look at a timeline of somebody's health, honestly, from in utero all the way until now, the current issue. And you see that the bucket was getting full until it was finally, spilling over in terms of chronic health issues. And kind of peeling back the layers of the onion in somebody's health journey. It's usually never one thing, one smoking gun. It's usually the combination and the interplay of genes and environment and diet, and exposures and things like that. And each person is an individual. Each person's why is different, and their how can be different, even though they have the same diagnosis. So it's digging further. It's really getting to the root cause, as opposed to a Band-Aid approach where we're just treating the symptoms from the downward effect. It's kind of like a faucet running all the time, but nobody's turning off the faucet. They're just trying to scoop the water out of, an overflowing sink. So that's really the difference to me, is digging in the why and the how. And most of it's modifiable. Most of the issues we deal with chronically are because of diet, environment, things like that. And so in stress, we had a couple cases that were phenomenal changes when they got to work from home, when there was their digestive issues, even though they did so much work on diet or things like that, they were mitigated. And when they could be in an environment where they were able to take care of themselves, that's a big part too. So many people are so stressed and they're not eating at work, or they're not getting time to eat, or they're delaying, or then just quickly grabbing something and then it's not digesting properly. So there's a lot of factors involved, but being a detective, I think, is a good description.
Yeah. And I think, it's often you both touched on that, like you said, Whitney, the interplay between, like, it's never just one thing. It's usually compounded things or things that affect other things. And stress is such a huge part of that as well. And I know, like, from my experience, we have someone in my life that has some digestive issues, and when they're stressed out, it just magnifies it like 10 times worse. So that works that way a lot. And we also talk a lot about, and you both touched on it, just the bio-individualisticness of everyone, and how, one person can react so differently to either environmental factors or certain foods, and that there's not that many textbook cases anymore. Everyone's so different. I mean, you can use things as like a base, but everyone just is so different individualistically and chemically and hormonally, and because there's so many factors to keep track of. So definitely. So I also wanted to talk about some of the specific chronic illnesses that are kind of the most common, and what are some of the main things that lead to them. And I know probably a lot of them will overlap, but we can maybe start with one that is a pretty big factor, not just in Berks County, but in specifically the United States, but all over the world. It's getting worse, is obesity. So can you guys anybody can jump in here that feels like they, as far as what exactly is the difference between overweight and obesity and what can lead to that? I mean, we know obviously diet, but are there some other things that are coordinated with that that people should be aware of that might not be talked about as much?
I'll start.
Sure.
So first I'll ask everyone, I can see most people, you have your cameras on. Who knows your A1C, your hemoglobin A1C levels? Have you had that blood test done? If you know that answer, raise your hand. Who knows your fasting blood glucose level? Like if you went and had blood tests recently, who knows that number? Raise your hand. So there's just a few very simple and very cheap, sometimes free, because it's a lot of those are covered with insurance if you meet the criteria. And they can give us kind of a window into how our metabolism is working. They're not the best measures, but they're decent. Or even better yet, another really great measure that's completely free is taking out the cloth tape measure and wrapping it around your waist at your belly button. If you're a male, I'd say the cutoff 36 to 38 or above indicates that you could have some metabolic issues that eventually will lead to diabetes and hypertension, high cholesterol, and some of those other things. If you're a female, like 34 to 35 is usually a pretty good cutoff. Or another general rule of thumb is 1/2 your height. So if you're 70 inches, you should be 35 inches or less around the waist. And so there's some really easy indicators. But to go back to the A1C and the fasting blood sugar level. So A1C is a 3-month average. That's why it's pretty good, because it's not fluctuating up and down. Because if depending on what time of day you get the blood drawn, what you've eaten the day before or the day of, what stress you're under, that could fluctuate a lot. But an A1C of around like 5.5 or less is pretty good. Once we get up above that, then it starts to indicate that our blood sugar levels are just too high. Same thing with fasting blood sugar levels. We should be between like 80 to 90. I know the normal is, or the not abnormal, I should say, the lab ranges take us from 80 to 110 sometimes. But once we get up above 90 on a regular basis, that starts to become a little bit much. And the problem with that is once it goes up into the hundreds, then our body starts to have problems dealing with that extra blood sugar. And the blood sugar is usually high to begin with, either because of abnormal stress, poor sleep, or eating the wrong foods for our body, chronic infection, or some other things too there. But we spend too much time consuming these sugary foods and these simple carbohydrate foods. So breads, pasta, cereal, grains, stuff like that. A lot of that comes from the food pyramid stuff that we've been kind of taught all our lives. Unfortunately, that was probably very, very wrong. But the bottom line is that it's left a big bulk of the population, projected up to 50% of us by the year 2030, having obesity, and then a big portion of those having diabetes. But thought I'd start there and just kind of define the problem and why we're there, and then we can dive a little deeper if we want to.
Yeah, that sounds great. Whitney, do you have anything to add?
Yeah, so I guess as far as the numbers that Buddy was talking about in the ranges are super important. And the fact that those aren't usually, not all of them are standard tests. Fasting insulin is not, HA1C is not really until you start having a couple high blood glucose readings. Those are very important for everyone to get involved with your practitioners to get those scripted for you. The other issue is that we are in an epidemic of overweight and obesity, and we have 70% of the adult population is overweight, and approaching, it's about 30% are obese and approaching 50%, like he said. And it's making us susceptible to so many other issues. If you are overweight or obese, you're more likely to then get diabetes. You're already on the continuum of insulin resistance, and you're more likely to have a heart attack. You're more likely to have dementia, Alzheimer's. They call it dinosaur brain. The bigger you get, the smaller your brain gets. It starts to atrophy when the blood glucose is high. And so it's really a national problem. It's an issue where it's starting to affect military enrollment. It's starting to affect people's ability, obviously, to be physically active. It's affecting fertility. So these are major issues. And tonight, I think we're also going to talk about how it's affecting immunity. And all of those chronic illnesses show that there's already immune dysregulation and that there is kind of suppression or dysfunction of the immune system. And that's part of the interplay of those metabolic syndrome issues. And they all have commonalities with issues with the gut microbiome too, which I know is something we'll get into.
Yeah.
And that affects immunity too, and our ability to regulate blood sugar. I mean, there's gut bacteria that they call obesogenic because it causes
Wow.
you to absorb more calories and put, so there's all these factors that add up. But environment, not just diet, but he was talking about the breads and the pastas and the sugars, absolutely. But also chemicals and obesity. There's, endocrine disrupting chemicals and plastics and the foods that we're eating, the pesticides used in conventional agriculture and things are actually making people bigger too. And because they're disrupting insulin and hunger and fullness hormones, thyroid hormones, adrenal hormones, things like that.
Yeah. Again, it's that interconnectedness, right? It's not just what we're eating, but how everything that makes up what we're eating affects the rest of our body, our hormones, our metabolism. It's all connected. Yeah, and you guys kind of, even right off the bat, just the obesity and the metabolic, just as far as insulin resistance and, approaching prediabetes and diabetes, they go hand in hand a lot. Do you see patients or clients that, I think there's a misconception that they don't necessarily, like visually, like someone could have diabetes and not necessarily be super overweight, right? So that could be a misconception that might be out there.
Yeah, I do truck driver physicals in my office, and I'm often surprised. I'll have a guy come in and he looks thin, and we do a urinalysis, and he has lots of sugar in his urine, which indicates diabetes. So it doesn't just affect the obese. And
yeah,
so
I just wanted
to be careful. It could be a false insecurity. Just because you're not heavy doesn't mean that you're not having issues.
Right.
In nutrition, we call them TOFIs, thin outside, fat inside. When you have this layer of fat around the visceral organs, so your abdominal organs, fatty liver, you don't have to have a large waist to be unhealthy. And the estimates, according to research, put the US numbers at around 12% or 13% who are actually metabolically healthy. So even if they're not overweight or obese, it doesn't take away the risk factors of heart disease or diabetes or stroke or anything like that. So that can be a common misconception.
Yeah, I definitely wanted to mention that. So I guess we'll move on a little bit, unless anyone else can chime in if you have something else to mention about kind of the metabolic health and obesity. But I want to kind of keep us moving a little bit. So next, if we can talk a little bit about heart events, so cardiovascular, high blood pressure. So what are some of the things? I know with high blood pressure, stress is a huge part of that. But can you guys talk a little bit about that aspect, the cardiovascular aspect, and maybe obviously exercise fits in there too. So a little bit about what to watch out for and kind of what letting things slip could turn into.
I'll let Whitney go first in this one.
I didn't know if anybody else wanted to jump in. Cardiovascular issues, it's all about inflammation. Our biggest of drivers of everything has to do with inflammation, which is an immune reaction. Some of it's overreactive, some of it's underreactive. When we're talking about cardiovascular disease, we're really talking about inflammation in the arteries. And why would that happen? There is a lot more data coming out that there is some level of autoimmunity in some of these cardiovascular diseases that hasn't really been discussed that thoroughly yet. So there's a lot to be said for diet and leaky gut and things like that when it comes to cardiovascular disease that are often overlooked. We're always saying, oh, you got to exercise more or you got to lose weight. But we're not talking about what are some of these factors or what are the mitigators of these risk factors and why? Like why is omega-3 fish oil healthy a healthy fat for the arteries or stuff like that. It's anti-inflammatory. Or so definitely inflammation is a driver. I always think of sugar as like sandpaper, like excess sugar in the diet, and the blood is like very oxidative. It's like rust, and it's just going to rust up all your organs and eventually make them very dysregulated, very not working properly, and then the hormones become imbalanced and everything else. And so when you take sandpaper to the inside of the organ or the inside of the artery, you're going to get some type of like redness, pussiness, bleeding a little bit, just really. And then the body tries to heal that, and it sends white blood cells, and it sends all these immune cells and fibrin and things to sew it back up. And that's the plaque. And that's the things that it's really the healing mechanism is the body is what eventually clogs an artery, because it was just assaulted so many times. When you're on the inside forming a scab, you don't have very far to go in the little arteries and stuff like that. So helping with stress reduction, lowering blood sugar, losing weight. Yes, those are all very important. Getting inflammatory foods out of the diet, like fried foods and highly refined processed foods and products. And then putting in anti-inflammatories like greens and berries and turmeric and wild-caught fatty fish and things like that. So yeah, cardiovascular disease is our number one killer. Men, women, doesn't matter. 700,000 people per year and growing. Yep.
Yeah, just to highlight that important point of inflammation, that seems to be the main driver in most of the illnesses that we suffer with these days. And so there's a continuum. People need to understand there's a continuum in the body between anti-inflammatory and pro-inflammatory. So we need inflammation. Inflammation is the immune response. It's protective. It starts the healing response. We need inflammation, but we need a balance there. We need to be able to turn it on appropriately and then turn it off appropriately. And the problem is that we participate in way too many things in our lifestyle. We eat way too many things that are pro-inflammatory. So we're always kind of right on the edge where we're actually causing inflammation all the time, whether our body needs it or not. And then if something happens, like we get an infection or we have an injury, or we have high blood sugar and we're sandblasting the inside of the walls of the arteries, then we're going to create a lot of inflammation there and cause even more issues. So we need to do more things that are anti-inflammatory. So pro-inflammatory things are things like smoking, eating too much sugar and refined carbohydrates, being stressed out all the time, not sleeping enough, not getting enough exercise. Anti-inflammatory are eating whole foods. So our meats and veggies, some nuts and seeds, but not necessarily the oils, and then getting exercise, getting plenty of sleep, doing things like meditation, journaling, and things like that. So what we all need to do kind of as a collective society is to get more of those anti-inflammatory strategies, activities, and foods, and try to get rid of some of the pro-inflammatory stuff. And the problem is we're eating, as far as the food's concerned, we're eating way too much of stuff that we've never eaten before in the existence of humankind. So it's only been up until maybe the past 60, 70 years that we've had some of these seed oils and some of these, they're unsaturated, polyunsaturated. They're supposed to be healthier for us. Things like margarine. If you're still using that, I cringe when I hear people
totally.
are still eating margarine. It's like, we need to get the word out if people are still doing that stuff. And those seed oils, and instead use, and this is going to make other people cringe, like using things like tallow and lard and some of those things in a limited amount. So we still don't want way too much. We don't want to go overboard to the other side, but we need some of that stuff. But the way we were taught to eat is super low fat, use all of these seed oils, which are highly oxidative. They break down, they cause damage, oxidative damage, and inflammation ultimately inside of our cells. And they increase obesity. And so, yeah, we've just gone totally off track in the wrong direction to the point where you tell people to use butter, it's getting better. But 10 years ago, you tell people to use butter instead of margarine, you're like, oh my God, you're going to get high cholesterol and die of a heart attack and all this other stuff. And it was almost impossible just getting people to eat a little bit of those healthy fats because they're going to get fat and then become obese and get all those other diseases. So we really just need to kind of help people understand what a normal healthy diet looks like. And it's nothing like everything we were taught in school and everything we see on TV and everything that's shown to us in commercials and all that stuff. And it's a tough job, but that's why we're here.
Absolutely. Yeah. And I think that you're right, guys. Like, I think what we're now used to as a society, unfortunately, is that we're just bombarding our bodies all the time. So they don't have time to calm down and actually heal, because they're like in the process of healing all the time, because we're throwing all these things at it that they need to attend to all the time, whether it be eating things, you know, that are inflammatory. So they're trying to calm things down, you know, just like when you sprain your ankle, right? It's the same, your body responds the same way. It sends things to try to take care of that. But when that's going on all the time, and then you add on stress, and then you add on not getting enough sleep, and then you add on not moving your body, it really adds up negatively. So it's about building those habits. And that's what this whole series wants to talk about. So tonight we're going to cover some of what it looks like when you're not doing things right. And then Sherry, did you want to share something? Sherry, did you want to add something? She came up on my speaker view.
Yeah, my internet connection.
It's slowing down. If you want, you could try turning your video off and
the message about, can you hear me? I don't know.
Yeah, we can hear you. Your picture's a little frozen, but we can hear you.
Okay. Yeah, the message that I also wanted to emphasize that both Whitney and Buddy brought up briefly was about the cholesterol. The mainstream media, the mainstream doctors, and everyone still is under the impression that everybody has to be on a statin, and that every time you go to the doctor, it's like, oh, your cholesterol is a little high, you need to go on a statin. And that's, I think, a real big misconception, and not, people aren't really understanding that what a healthy cholesterol level is, and that there's many nuances to it. And that, I think, is another thing that needs to be put out, education more. And in addition to de-stressing, I think, is another big thing that people have to work on, and getting them out of that fight or flight, and all the cortisol and bad hormones that also are damaging to the body. So
well, that's a good point. Thank you for sharing that. It's true. I mean, that's the unfortunate part about some of the traditional medical system, is that, oh, this number's a little high, let's give you a pill. And they might say, watch your diet, but they can't really tell you what that means. So that's what a lot of people in our community are here to help with. If there's a lot of people that kind of, you hear that and you don't know where to start. So no, it was a good point to bring up. Thank you. I also had on here kind of lung events and respiratory. So I don't know if anyone wants to chime in about how, I know, Buddy, you mentioned smoking, but are there other respiratory things that you guys see that really can negatively affect and be a risk factor to other things? I know you hear a lot about like COPD these days, and do you count asthma as respiratory? I guess you can. So how do some of these things, and that could be allergies. So what are some of the interconnectedness when you talk about some respiratory issues that people see commonly?
Yeah, sure. So it all goes back to the whole inflammatory response. If you're inflamed, and everyone's different. So if I'm inflamed, my joint muscles might hurt all the time. If you're inflamed, it might come out as asthma, skin issues, migraine. It could be a variety of things. So some people just have a kind of an elevated histamine response because of elevated inflammation in their body. And it could be from exposure, it could be pet stuff in their house. It could be mold is a major issue. It's kind of damp around here. It's humid all the time. So a lot of people suffer from mold related illnesses, and they don't know it because of something that's never tested for. It's tough to test for sometimes too. But mold is a big issue. And again, it's, you could live at home with a spouse and they're fine. You're in the same moldy environment, because of your genetic variations and the way your body's working or not working, you might have major issues like chronic fatigue syndrome and all sorts of illnesses and issues. But yeah, with the respiratory stuff, mold is huge. Anything that elevates the histamine response. We see like things like COPD and stuff like that certainly is an issue as well, but that's usually some sort of either environmental, so at work they're breathing in something, or maybe they smoke, of course. These days we're seeing more and more vaping, which can damage the lungs. And then especially as it relates to COVID, I mean, that's one of the main organs that it hits. So if you are not in tip-top shape in that area, then you are at more risk for having major respiratory issues if you are affected.
Anybody else about respiratory?
Well, yeah, it's another immune type of kind of dysregulation syndrome. Well, at least asthma is. And you know, if you think about any of the autoimmune lung disorders or fibrosis or anything like that, and there's a big connection with the gut microbiome, but the lungs also have their own microbiome, and there's an interplay between oral bacteria and microbiome, lung microbiome, and gut microbiome. And like you can actually, like, depending on what lives in your digestive tract, the 100 trillion or so, are creating immune chemicals, or positive ones like lactoferrin and things like that, and or they're creating toxins, and if they're the not so friendly types. And so you often see, you know, a dysregulated microbiome in asthma and lung issues. And then it became, you know, you become more susceptible because your whole mucosal lining, you know, from sinus all the way down is kind of more leaky or damaged, causing proteins to get through into the bloodstream or into the lungs and stuff that normally would be more broken down. And then you have this immune response and reaction. Most asthma cases, a lot of them had atopy too, like eczema, or, you know, were bottle fed, formula fed instead of breastfed, or mom might have smoked, or there's this whole like timeline you can usually see there, or they took a lot of antibiotics as an infant and a child. Their vitamin D levels are probably low. That's a big one. And that's a big one for COVID. Over 80% of the cases, there's just a study out of Spain, are low in vitamin D. Over 90% of the deaths low in vitamin D. So I think one of the major things that vitamin D is kind of like a pro-hormone. It's not really a vitamin, but it regulates so much of the immune system function, gut function. That's another number I would add to Buddy's list, that everybody should absolutely know what their vitamin D level is. The 25-OH, you know, hydroxy vitamin D3, the usable form, because so many are low. In the United States, we have a big issue with low vitamin D, and it's just so easy to remedy, honestly. Get out in the sun and take vitamin D3 if if we're stuck inside all the time.
Good point. Thank you so much, Whitney. Yeah, there's, again, a lot of these are interconnected and play parts in each other's kind of demise or getting better. And a lot of them, the good news is it works the same way on the positive, right? So that when we are fixing our habits and doing better, a lot of times maybe we're focusing on one specific thing to do better, and all these other negative symptoms clear up at the same time. So next I wanted to kind of talk a little bit about, and we did touch on some of these things, but maybe we can talk about them a little more, as some of the common barriers to healing or to getting better, or just things that are in our way as a society. Essentially, I think one of the biggest things is just people just have a lack of awareness of how huge lifestyle changes are to drastically improve our health, and our quality of life is another thing too. It's not necessarily just about getting and staying healthy and maintaining that, but just the quality of life, just feeling good, having energy, feeling like we can have enough energy and feel good enough to do the things that we care about. What do you guys think and this is something, or other people can chime in too, what are some of the things that you think are the biggest barriers? I mean, do you think it's the systems people are used to, as far as allopathic and prescriptions? We could talk about that first a little bit. So I know it's hard. We know that the medical, the study of medicine is so huge and it's come so far, and If I'm in a car accident, I'm so glad the hospitals are here. But when it comes to chronic disease and chronic illness, there's just a different mindset. So what do you guys think some of the barriers are kind of in that realm? Just misconceptions or, you know, conventional wisdom that's not so wise that people are used to hearing about?
Yeah, let me lead into that. I'll let Whitney answer a lot of these, but I just want to kind of set her up here a little bit. I just want to go back and say, like, it might seem like it's the toughest question or most complicated question, but it's kind of the easiest for me and Whitney probably, because the other questions, and I could kind of see Whitney's kind of wheels start to turn when you're asking like allergies or skin issues, because those are hard to answer from our perspective because it's a different way of thinking. It's not like, because I always want to ask, well, okay, they have allergies. What's their skin like? What are their bowel movements like? What's their sleep like? Do they live in like a damp, moldy house or workplace? And so you always kind of want to like think about all of those other things that are the root causes, Whitney called it earlier. But with this question here, the obstacles, this is kind of really where it gets into the foundations of what functional medicine is. It's looking for those blind spots. And as everyone's listening here tonight, that's what at least what I want people to start thinking about is, all right, if you've been struggling with issues for years, what are some potential issues that you haven't been exploring? Because if you go to the doctor, you get blood tests done, the doctor usually says, oh, everything looks great, but you don't feel great. So, you know, they're not testing for the things that are leading to your issues. So yeah, it's if we get anything out of tonight, I hope it's that people start to think a little bit differently about how they feel and the issues they're dealing with, and then start to look into some of these I call them blind spots. It's things that are happening to us or things in our environment or things that we're doing to ourselves that we might not necessarily know that we're doing wrong. But for that part, I'll toss it off to Whitney or others.
Yeah, I mean, I think that with conventional medicine, it tends to be decades sometimes behind the scientific research till things get accepted into clinical practice. It's like, oh, well, we knew that in 1990, you know, there was research to show that. But and you can understand that science is a ever evolving process as people learn new things and add to the data. But we have a lot of information to help people now. And like Buddy said, the basics go so far. I mean, you can change people's lives with just changing a few things in their diets a lot of the times, and it's nothing crazy, you know, but then there's other complicated cases, like extremely, and we always see them in functional medicine. They come to us, you know, the very complicated cases. But if you can change those basics, for a lot of people, it's going to change a lot of things, because what you put on the end of your fork 3 times a day, 4 times a day, 5 times a day, that adds up. And over time, if it's the wrong thing, you can imagine that your building blocks are not going to be the greatest. You know, if you're building your house out of McDonald's or whatever, it's not going to operate properly. And eventually you're going to come crashing and have an issue. So those things are so taken for granted, I think, that when you go to the doctor and they do start to see things off in your blood, or maybe the other tests aren't being run, like an HA1C or a vitamin D or anything like that, and you just continue to get worse or feeling worse, it's, oh, well, you just need to lose some weight, or just get out and exercise, or just eat less. Eat less and exercise more is really terrible advice. It got us nowhere, just like that food pyramid got us more fat and sick. Just like demonizing fat in the diet got us more fat and sick. So a lot of it is common sense. A lot of it's going back to the roots, or ancestrally what people ate. If you just think about, oh, well, my entire family came from Mediterranean Sea area. Like, I'm either Italian or Middle Eastern, or, okay, well, what does that diet look like? Does that look like what you're eating now? They're very just like basic principles in that way. And I think that there's just such a strong push for drugs for chronic illness, because it's huge money makers, like the statins, blockbuster drugs, you know, acid medications, things that just actually make people worse in the long run. but it mitigates the symptom for now. And they never get to the root cause. So they're just going to tack on another drug and another drug and another drug for the other symptoms that they're developing because they never dug down deep. So those are the major hurdles. And a system of insurance and things that don't pay for the right things either. You know, vitamin D is not even covered by insurance still, by most insurances. So there's a lot of hoops that we have to jump through as holistic, functional, integrative practitioners. But more and more people are realizing, I think, the power of food, the power of movement, the power of stress reduction, meditation. It's just a matter of now implementing it into your lifestyle. And like, this is the way I live now, you know. And that's the motivating factor is to help people get to that point.
And I think a lot of the unfortunate thing is a lot of people that are maybe not even sick right now, but just dealing with things like chronic pain or just fatigue or just not feeling good. Like, but they think that's just how they feel. You know, we've talked about that before in other discussions where someone says, oh, maybe they have some minor digestive issues. It's like, no, if you eat something and you have a negative reaction, like there's a problem there. You have to pay attention. So that's another thing I think as a society, we don't really pay as much attention or listen to our own bodies. And I know that this group and pretty much everyone in the Downtown Wellness Berks community is very much about empowering and helping to empower the individual to help people realize that it's really up to them. They will have people that they can lean on for support and help. But really, like, you're the one that knows your own body and what's going on in it. And you need to be able to express that to the people that maybe can help you, but it's really up to you to take the measures to make things better.
Yeah, I agree, Courtney. That's so important. And people need to be advocates for themselves.
Exactly.
When they go, they need to have the courage to speak up and say to their practitioners that, hey, I don't want another prescription. I want to deal with this in a natural way. And it's really hard. I mean, even for somebody that is knowledgeable about what's going on with their body, it's really hard because there is a huge pressure from most practitioners to just write that prescription and say, here, this is what you need to take. And then they look at you like you're crazy if you don't take it. So I think that people just need to get that courage and that awareness of their own bodies. That's so important.
Absolutely. Maybe we can touch a little bit about kind of antibiotics and how, yes, there's a place and time for them, but it seems like these days they're kind of handed out like candy, like here's your Z-Pack, feel better. And how detrimental that can be, especially and we've talked about this and we will talk about this in our, other sessions, but just touch a little bit on gut health. Can you guys talk about the importance of gut health and how it connects to immunity?
I think Marty wanted to say something first.
Marty, go for it. Oh, you raised your hand. I'm sorry. Thank you.
The question,
Thanks,
just
Whitney.
said listening to your body. Whenever I say that to anybody, they get this deer in the headlights look. Because that is such a life practice that if you can give some suggestions about what that might look like for people to figure out, what am I listening to? I mean, how would I know?
I can give you a personal example for myself. So lately, for some reason, just because of the way life is going for me these last few weeks, we have not been able to cook at home lately. So I've had to get food out, and that usually means I don't have a lot of good options, especially if it's dinner time, because Farmhouse is already closed. So I don't have a lot of options for vegetarian or vegan. And I'm not either one of those. I just don't eat a lot of meat. But I know that when I do eat meat, like more than once a day, guess what? Inflammation, my joints hurt. And I know that and I feel that. And it's something I know about myself, that when I eat more meat than I normally do, or meat of a lesser quality than I usually do, my body tells me that by being inflamed. Just like when I eat regular pasta for lunch, my metabolic system goes crazy and I want to fall asleep. So things like that, where just knowing how you feel after you eat something, or how you feel when you don't move your body that day. If I get up and it's 11:30 and I haven't done my stretching and yoga, my body's yelling at me. It's saying, why didn't you do that? So just things of how you feel, whether it's physical, the manifestations that happen, or mental. Like there's things that happen that if you don't do certain habits, you're feeling a little more down or a little more anxious. It's just an awareness. So that's my answer for what it looks like or seems like to listen to your body.
Do you tell people to keep food diaries and then write down after if they feel a certain way, that they go back and look at their food diary?
That could be a good practice. I know, Whitney, you usually have your clients do that.
Yeah, and I have them record any symptoms too. We also utilize something called an MSQ, or a medical symptoms questionnaire or toxicity questionnaire, something where they're ranking like over the last 30 days or the last 60 days, like how often does this happen to you? Is it never? Is it rarely but severe? Is it rarely but moderate or mild? Is it sometimes but severe or mild? Is it frequently and severe, or is it frequently and mild? And that can kind of rank things for people in their minds. And then when, as a practitioner, if you can go through and see like how those systems interconnect and what is really the driving factor, like are they scoring off the charts in digestive issues, and then they also have skin rashes and migraines, or stuff like that, so, or joint pain. A lot of it has to do with maybe you're not breaking something down properly, like the concentrated protein in the meat or stuff like that. So it's something that is very important, and it helps people to start to be aware of what they're eating, because 9 times out of 10, it's very eye-opening just for somebody to start journaling what they're eating and how much of it that they're eating. And then especially if you're using a tracking system and you can see how much sugar the person's eating in one day, all total sugar from fruit and Twinkies, everything put together. And some people are like, holy moly, I mean, they're eating 200 grams of sugar every day, and it's just insane. So that can be very eye-opening. And that can evoke change. The same with correlating symptoms with what they're doing, and realizing that the symptoms on a Pepto-Bismol commercial of the gas, bloating, diarrhea, constipation are not really normal, or shouldn't be that chronically happening like that. And that can be a little bit eye-opening too, or knowing that now they know maybe a headache is coming from something I ate, or that I didn't sleep enough last night, or something else is going on hormonally or whatever. So yeah, definitely those are the tools to help people look inward and to start to reconnect to their bodies, because a lot of activities and things are just done mindlessly. And so if we can get everybody to be mindful about their practices, about what they're eating, doing, saying, drinking, sleeping, etc., then that's usually the first step.
And correct me if I'm wrong, guys, but don't you think with your clients and patients that people just don't realize how good they can feel? Like they're so used to feeling bad that they, once they start feeling it, it can really help the momentum. And then they, tack on one good habit, and then they feel better and have more energy to keep up with things. So then they tack on another good habit. So, and we know that a lot of these illnesses, they obviously don't happen overnight. So they're not going to be fixed overnight either. And sorry, buddy, you were going to say something else.
No, it kind of ties into that. I like to kind of go back to the old scientific method, and I teach people this study of n=1. So in research, n equals a number of participants in the study. In this case, you're just studying yourself, so n=1 is you.
Yeah, that's
And
awesome.
I like to follow the pattern of test or measure or observe, do some sort of intervention, and then retest, remeasure, and observe again. It could be low tech. It could be just simply, am I getting up and feeling refreshed? On a scale of 0 to 10, what are my energy levels? Can I breathe deeply through my nose and I'm not stuffy? How are my skin rashes? What do they look like? It could be higher tech. It could be blood testing. It could be blood testing and some of the testing that we order as functional medicine practitioners. It could be something even higher tech that's kind of new, is like Aura Ring or these wearable devices that we have, where we can measure heart rate variability, or HRV, heart rate overnight. If I'm doing poorly, if I eat pizza and have a glass of wine, my heart rate's elevated like 65 all night long. My body's stressed out. If I'm eating well, my heart rate will drop down into the low 40s. So you can see those devices and get some objective data there. You can measure and see how, or not measure, but feel, is your wedding band really tight? So there's lots of things that we can observe and mark down and record, and then follow something and then check it again later. Now, the challenge with a lot of the interventions that we teach, and ultimately the interventions that will do the most good, is that it's not such a dramatic change from one day to the next. So you might have to go, I've talked to people all the time about going gluten-free. Yeah, I cut it out for 3 days. I didn't notice anything. Gluten antibodies and the gluten response in the body could last 21 days or longer. So unless you're going gluten-free for 30 days, you never went gluten-free. Oh, and then I went gluten-free for 5 days, but then I cheated. I had a burger over the weekend because I was so good all week long. Well, now you just reset that 21 days or that 30 days again. So they never truly went gluten-free. And when they actually do, like you said before, they realize, like, holy crap, this is how much better I could feel all the time just by avoiding the gluten. But again, the difficulty is it can take time to see those differences and see those changes. That's why we have to measure them. And then 2, it can be hard work. Taking a pill is easy. Taking a pill and then measuring, okay, my headache's gone an hour later, is different than avoiding gluten for like 4 weeks when you've never thought about gluten before in your life. And it's a lot of the foods that you like, and it's a lot of the foods that your friends feed you and you're tempted with all day long. That's a little bit harder. So that's where there's some bit of work involved in this approach.
Absolutely. Absolutely. I think that's another barrier, a big barrier, like we talked about earlier, is just, it's not recognized as like normal to take care of yourself, to take care of yourself to the means of actually cutting out things that might be harming you. And there is a lot of pressure within your family and friends and just society in general. And we'll talk more about this, like the specific food stuff. We'll go into that, a lot of that next week, which I'm really excited about too. I thought it was funny how you joked, buddy, about my body tells me to eat pizza. So I think that's another good thing. Like, yes, unless there's a specific reason to cut out this stuff, it's almost impossible to cut out one specific thing 100% of the time, unless you absolutely have to. But it's okay. Like, if you know your body responds a certain way and you know it's just going to be once in a while, like, it's not worth beating yourself up. I think that connects to the mental aspect of it, and why diets don't work, because people say, oh, well, I cheated. Oh, it's not even worth it. And we'll talk more about that too, kind of the mental aspect and why that is so hard sometimes. But the dependency thing is big. And I know Marty talks kind of about her sugar dependency a lot. And it's just such a huge thing when people are so used to eating these things that they feel that they need. Can you guys talk a little bit about sugar? And I know there's some chemicals in cheese that specifically, they light up those sections of our brains that are rewarding and that make us happy, and how it's really hard to give up some of those things.
Tiffany had a comment from the last section.
Yeah.
Tiffany.
Oh,
Yeah,
thank you.
I wanted to, this is the first time I've participated in one of these things. I was kind of listening a little bit, but I wasn't sure when to speak up about it. But
Thank
just
you.
to
Thank
go
you guys
back
for helping
through,
me.
Like the way that herbs can fit into all of this
Yes,
and help
please.
out. Kind of wanted to go through each topic. So like we were just talking about gluten and how, gluten can kind of cause damage in the GI tract. So that's in a place where like herbs like marshmallow and slippery elm and demulcents and mucilaginous herbs can help because they they heal and seal the gut mucosa and allow it to repair itself, um, and remedy things like irritable bowel syndrome or and then with obesity, there's a saying like you are what you eat, digest, and don't eliminate. So that's where herbs can come into play. Things like digestive bitters, your gentian, your orange peel, they can help us digest the foods that we do take, like increase different gastric juices and to be able to break foods down. If someone's having trouble with fat metabolism, there's herbs like artichoke or dandelion root that can help with that. Because, if we're not digesting our foods properly, then that can lead to inflammation and, a domino effect also lead to obesity because we're not metabolizing those foods properly. I agree with what everyone on the panel said that like sleep is a huge, kind of starting point. Can just lead to inflammation and all other body processes not helping and not working correctly. But this is where, you can tell someone, yeah, get more sleep, like it's just as easy as that for them. And a lot of times it's not, sometimes it is just making that choice. I'm going to turn off the TV and go to bed. But sometimes patients need more help with that because they want to sleep, but they're not able to. And so we have to look at the root cause of their sleep problem. Is it a digestive issue cause? Then there's times where like chamomile is good if the problem is digestive issues. If it's because they just can't shut their mind off, so they're not able to sleep, then herbs like passion flower can help. If it's nightmares, herbs like mugwort can help. So this is where it goes in. It's not one size fits all. You really have to get to know, it might be that they have restless leg syndrome, that's why they can't get to sleep. So there's, different herbs that are going to be able to help them get the sleep that they need. And that's the starting point for all of it. As far as like the stress that can lead to inflammation, there's herbal adaptogens that are helpful that help re-regulate the HPA axis, things like eleuthero and ginseng and rhodiola and ashwagandha, and choosing which ones, I think that's where a lot of times people come in with this preconceived notion because of like Google, I just Googled like, herbs that are good for sleep or herbs, and they don't know which ones to take though. And that's where, I get excited, like educating people on that. And, it's so much more. You have to look at things, yes, like the contraindications, other conditions or medications that they might be on, but helping them choose ones that are right for them based on their energetics and their constitution. And a lot of times going through, even if you still have a handful to pick from once you eliminate certain herbs that aren't right, being able to choose herbs that can kind of cover two or three, kill three birds with one stone, so to speak, because a lot of these herbs don't just have that one action like pharmaceutical drugs have. They can help with things that they didn't even realize were related. And then with immunity, let's see, inflammation, herbs like reishi can help with inflammation, immune, let's see, I'll get to that one. Immune amphoterics that, when people aren't able, maybe because of DNA abnormalities, that's where sometimes it helps to find out, why they have systemic inflammation. It could be a food that's causing it, and eliminating that food can be helpful. But sometimes even doing that's not enough. If they have a DNA abnormality where they're not producing the enzyme that they need to turn that cytokine cascade off, immune amphoterics can help, like cordyceps or cat's claw, maitake, ashwagandha, licorice. Licorice is a good example. It's a wonderful adaptogen and immune amphoteric, but you shouldn't take it if you have high blood pressure. So that gets into why, so much more than somebody just reading, oh, that's good for, overactive immune system. Let me grab some licorice, off the shelf and take that. And let's see. So, and another thing that popped up in my mind was about the emotional imbalances. One thing we haven't talked about yet is like the emotional component to where someone is, both with compliance and also, emotional imbalances can sometimes just be obstacles to healing, even if they're doing everything else correctly. So, we can address things like that with herbs or Bach flower remedies, flower essences. And even there are herbs like mimosa that kind of moves blood and moves the chi that can help get things moving again, both the emotional stagnation that someone might have, which it can also lead to inflammation, because if they are storing emotional emotional barriers somewhere, that can block that energy flow and lead to inflammation and pain as well. So sometimes when that emotional component is released and things are just able to flow more freely, the inflammation can subside as well. And then with antibiotics, there's herbs. There's not a lot of herbal antibiotics per se, but usnea is probably the closest that we have to an herbal antibiotic. And also with antibiotics, there's other herbs like burdock has compounds in it that are precursors to helping rebuild healthy gut flora as well. So a lot of people aren't aware that herb, it's not just probiotics that can help, and fermented foods, which even fermented foods, until you actually restore the right balance of, the healthy gut flora, you shouldn't use the fermented foods, because you can just be feeding the bad bacteria as well that's in the gut. And that's all interconnected as well, because the gut flora plays a role in inflammation and immunity as well. So just some, there's more, I don't know,
That's
different
great.
herbs that can help with, with the COPD and different lung conditions. Ginseng's good for COPD. Rhodiola is an antioxidant, helps with stress and depression, and helps to increase the blood circulation. So there's, and I also was, as far as, we were talking about insurance companies not covering some of these alternative modalities. I do like to incorporate into my consultations and the classes too, ways that people can use herbs that are local to them. Sometimes like weeds, what we call weeds right in the backyard. And
Go foraging, right?
yeah, yep, go foraging, and just teaching people how to forage them, so that this is something that can be accessible to everyone. And even just making your own tincture. So a lot of this stuff might not be available year round. And with like the dried herbs that I have, like I sell them loose by the ounce in my shop, and then teaching people how to make tinctures from them. I mean, you have something like the size, like a 2 ounce, might be anywhere from $25 to $80. And you can go through that in a week or two. And that can be really hard for people to pay for out of pocket. But sometimes just, $3 or $4 worth of herbs you can make enough tinctures to last you for, 2 months for just a couple dollars. So, I think that's a key component, is educating people, if they're willing to, if they want to be able to take this stuff, teach them how to make it themselves, and then it becomes an affordable option.
Yeah, I think you can kind of look at herbs and using herbs in the same vein of eating healthier, where if you're more involved in the process and you kind of are more familiar and educated, that you're more willing to incorporate it. So, seeing what the herbs look like, being more familiar with them, it's just like having your own garden. So you could have, your own herb garden. And if you're more familiar, you're probably more willing to be able to actually utilize it and incorporate it into your,
And some of the herbs have scary names and stuff too,
They
like devil's claw, and
I know.
people, it just, even when like that it's all perfectly fine, when it's like cat's claw and devil's club, it feels a little witchy to some people, and I think that scares some people off until they get familiar with them, and that that stigma is kind of,
At least you can pronounce most of them pretty easily, unlike some other things that come in bottles.
yeah.
No, that's great. Thank you, Tiff. I'm so happy that we have you on this team to give that side of things and to be able to talk about the herbs and some of the other alternatives that people can think about. So I appreciate that. I appreciate that a lot. We're getting close to 8 o'clock. So I said I was gonna, I don't want to be, I did have one question from someone that was kind of specific. So I don't know how you guys feel about answering this, because this is one of those specific things where you can either say what you want or just be like, it's going to be a tough one. But Jane was asking about views on the shingles vaccine. And then if anyone else has any questions, we'll get to them. Or if you want to type them in the chat box, we can get to you. And we have a couple minutes left here. So does anybody have any input on the shingles vaccine or shingles in general? I don't know if Buddy or Whitney, you've had any clients that have dealt with it, or Buddy pleads the fifth. I know it's hard when it's specific things like that. It's kind of like, different for everyone.
I will say this though, because everyone asks about vaccines and
Yeah.
they're such a hot topic, and
Yeah,
you're either
they are.
anti-vax, you're pro-vax. And if you're anti-vax, you don't use any. If you're pro-vax, you think everyone should get every vaccine ever made, even the ones that were taken off the market years ago because they paralyzed people. I think the answer is somewhere in between. And you have to know your family history, even like your mom, your grandmother, your siblings, did they ever have any bad reactions to vaccines? If so, well, then you might be at a higher risk of having a reaction yourself, or an adverse reaction, especially if you had reactions in the past yourself. But it all depends on, like the shingles. If you have other health issues going on, we don't know everyone's health history here, getting the shingle vaccine and taking that small risk might be better than if you ended up with shingles and then was really, really bad shape because of that. Or same thing with the pneumonia vaccine, or same thing with the COVID vaccine that's going to come up. And, but yeah, it's such a personal decision and it stinks. And I'm a practitioner and I know the biochemistry and I know this stuff pretty well. And I have really, really smart practitioners and mentors that I know that are just, all vaccines are damaging. But I have other ones that say, well, no, it's not damaging for everyone. It can be actually very helpful. And thank God we have vaccines. So we don't get polio, don't get paralyzed anymore, or so that we can decrease the number of COVID deaths when that vaccine comes out. So again, it's a very difficult answer. And I think the main problem is that if you give everyone something, a portion of the people are going to react to it. Give everyone peanuts. Chances are, just in the people in this chat room, you give all of us peanuts, you might have one of us that has an allergic reaction, something like a peanut. So let alone a vaccine with a couple different types of chemicals in it. So that's what makes it so difficult to answer. What I do wish we could do is, as a healthcare system, is do more research, like find out, all right, a certain microbiome shift or gut bacterial makeup might change your response to a vaccine and make you more prone to injury, or different genetic variation called SNPs, SNPs. If you have certain variations, you are at higher risk of developing vaccine side effects potentially, because you can't detox the heavy metals, your brain tissue become more inflamed. And I've seen this in kids that we do genetic testing on for autism, and they all tend to have these same 3 or 4 variations. So instead of arguing over, yes, they're all safe, or no, they're all dangerous, we need to be asking the vaccine makers and our public health departments, let's find out why these people are having reactions and not bury our heads in the sand, so we can identify those people at high risk. And then everyone else, we can say, all right, mom and dad are really concerned, but you don't have the genetic variations, the microbiome's pretty good, so you are at a really, really low risk. Or, yeah, you're right, you are right to be concerned because you do have the variations. Let's give you an alternative version of the vaccine. Or maybe in this case, you are one of those people that can't get the vaccine. Because we always hear about get vaccinated because there are some that can't. But we haven't identified, or we don't have the ability to identify all those that really shouldn't get them. So I don't know if that answers the question, but that's what makes it so complex.
No, I think that's a good answer, that it is always complex. Tiff, did you have something to add to that?
Yeah, this is another place where, herbs can also help too. Like Isatis leaf is good for shingles, as well as Japanese knotweed. So that's a perfect example of something that's local, and Japanese knotweed is invasive. I mean, people are tearing this stuff out. People would probably pay you to come dig it up and use the root to make medicine out of. And that one, you don't have to make tinctures. I mean, that one, you just grind it up, and it's actually, you know, it doesn't dissolve very well in water, alcohol, maybe a little bit more so, but you know, it's best as like a food. You can just powder it and put it in capsules. And like I said, it's it's growing all around us. There's medicine growing all around us for something like that. So especially like Buddy said, you know, if you find out, like, you know, with more research, and we find out people who are high risk to take a vaccine like that, and, you know, well, what options does that leave them, you know?
Right.
And so that's where, you know, something like this can become an alternative for them.
Absolutely. Whitney, did you have something to add? Go ahead.
Yeah, Buddy answered it in a very good functional medicine way, but it's getting to the how and the why somebody would have a bad reaction, but also the how and the why somebody wouldn't be able to overcome an infection, or why is their body not able to. When you hear of polio and even COVID now, I mean, you're seeing why do 99% of the people recover, 98, 99%, and where is this like minuscule amount of people having these horrible reactions or dying? What is going on with them? And we just identified many of the risk factors. With shingles, there's usually a different type of immune kind of stimulator going on, like maybe mold, or, you know, something's depressing the immune function, which is why it usually comes out as you age. So if you can keep up the health of your terrain, and you actually become healthier as you're aging, and keeping up with vitamin D levels and blood sugar levels and your diet and eating your medicine, like what Tiffany's talking about, we can involve herbs in our everyday eating practices that are very powerful, like oregano and garlic and turmeric, and to fortify our microbiome and to help with our immune system. And there's this big schism. I think one of the schisms between integrative functional medicine and conventional medicine is germ theory versus terrain theory. And we want to fortify and build up the terrain of the person to make them more durable to live life, and, you know, and be resilient, as opposed to just treat a symptom, take a vaccine. You know, there's very little fortification and building health when you think of it so reductionist that way.
Yeah. We have the power to stack the odds in our favor by just doing some things every day that once we're used to them, it's just what we do, and it can really help us out in the long run. So that's awesome. Well, thank you guys. I don't want to go too far over. If there's any other questions, well, we can just come back next week and we'll go over stuff. But I just wanted to do a quick a thank you for everyone that has come and shared your knowledge. And thank you for all of those who have come to listen and learn. Next week, same day, same time, 6:30 on Tuesday the 17th, we're going to be digging more into the eating well. So we're going to be talking more and digging more into the food. We'll talk more about gut health, specifically what an anti-inflammatory diet looks like, talk about some specific nutrients. Hopefully we can have Tiff come back next week too, if she's able, so we can talk a little bit more about some supplements, herbs that can help us as far as fitting them into our everyday diet, and how eating will really reduce a lot of negative side effects of things that are already happening, and really stack the odds in our favor as far as preventative. So that's going to be next week, and I hope all of you can join again. And I really appreciate your time, and thank you everyone so much for being here for session 1 of Living Well. And we'll see you guys all next week. Thank you guys so much.
Thanks, everybody. Stay
Thank
well.
you, everyone.
See you next week, guys.
Bye.